This Greetings from BAIF, which is a public charitable trust and operating since 1967. It's committed to sustainable rural development. We have headquarters in Pune and central research station, which is of 110 hectares farm at Urlikanchal. We have 12 associate organizations, which we can call state level chapters in 12 states, 14 states of India. We are approved by ICAR and other institutes for scientific and applied research. We are pioneer partners in sustainable field programs for livestock development. The model which Dr. Pandey was referring to, the services at doorstep, that has been always practiced. We have semen freezing laboratory, wherein present production every year is 6 million doses, and our trustees are keen to increase it to 8 million doses, but not to the quantity which Dr. Pandey referred. Because we, of those 8,000, we almost have about not even 1% of the vote. 3%. Our other programs, we are not there only livestock development, we are also there in natural resource management, including the land and water. The community development programs, wherein we hand over the programs to the communities and then we are expected to exit or enter into new needs satisfaction for the community. This we do best with the fostering of people's organizations which are there, and then that program is taken care of by those organizations after the project periods. We have some experience of working with the formation and stabilization of community-based health insurance schemes for human population. And one of the experiments which we started in Urlikanchal was studied by many researchers, and it was started in 2000 and still it is going on. We started with some 100 participants and we have now increased to over 3,000 participants, and that's being run entirely by the community now. Now we are not into it. Next slide, please. Pertaining to the challenges, we feel that there is very low or poor awareness about insurance, about the concepts of insurance, about the management at the level of farmers. Whatever operations, whatever insurance schemes are available, they are basically from the commercial insurance companies, and they are mainly for death of the animal and total permanent disability. Some of the companies have started covering partial disability also, but the problem is that all this certification, documentation needs veterinary, and the availability of veterinarians at grassroots levels is not to the extent desired. There are certain subsidy-induced schemes which make compulsory, and then that further leads to fraudulent operations, which most of the participants have already mentioned. And now it doesn't stop only there. Further, it leads to the reduction of the trust of the actually needy population in the insurance schemes, because the mistrust is best advertised by mouth-to-mouth publicity in an area. The service providers, they do have in their mandate to cover the rural areas, but most of the offices are situated either in district places or divisional places. Now, like United and other companies, they have established offices even below districts, but they are not sufficient. The demands are quite far, and they have not reached all the population. Further challenges are the process of submission of documents, either for registering the animal or for submitting a claim. they are very tedious. Most of the time, the use or non-use of local language makes it difficult for the population which that is going to avail.